Okay, so good afternoon, everyone, and welcome to the second online session of this year's ukactive National Summit. It's fantastic to see so many of you logging on to join us today for what we hope will be a really engaging discussion around how we can use data and evidence for effective interventions in health and wellbeing. Last week, in our first session, we heard from Baroness Tanni Gray-Thompson, the ukactive chair, around the use and vital role that data collection and sharing has in our sector's evidence and fight against COVID. And we also heard back in the summer from Professor Greg White, who's the chair of ukactive Scientific Advisory Board, around how data is used and the similarities between elite sport and also our sector, and how it's really important that this informs decisions. And what's really important for our sector as well is how this data is translated to help those decision makings and shape and inform policy and practice. So in today's session, we're going to be looking at how we can measure and create those interventions that are effective for health and well-being, and go right from the data collection aspect right through then to practice and policy, and how this data can inform across children, young people, through adulthood, working life and active aging. So the session will be split into two parts. We'll start by hearing about the value of sport and physical activity from Andrew Spears and Dr. Larissa Davies. We'll then have a short break to move around and get a cup of tea. And then we'll come back into a panel session where Larissa and Andrew will be joined by Jess Kuna and Dr. Lawrence Foweather. We'll then finish with a Q&A. So please, guys, use the Q&A function at the bottom to send in your questions as we go through, and the team will collate them and we can put them to the panel towards the end of the session. So just a few housekeeping things before we kick off. The session is being recorded. We will be posting this on our YouTube channel and sharing this through our social media. So please share afterwards, and you can obviously pop back if there's any key things that you want to have a look at. Everyone will have been muted on entry. I've mentioned around the Q&A function, so please, guys, do use that. And if you get cut off, then please just use the same link and you'll be able to jump straight back into the session. So finally, and by no means least, I'd just like to extend a thanks to Sport England and the City of London for supporting our National Summit this year, as well as our strategic partners for all your continued support in all the work that we do. So let's get started with the first part of the session, and it's absolutely fantastic to be joined by Andrew and Larissa, who will be discussing the value of sport and physical activity, findings of which were published earlier this year in September. So Andrew and Larissa, it'd be great if you switch your cameras on and we can jump into the session. And if you could start by just providing a brief introduction to yourself. Andrew, I'll hand over to you.
Thanks, Matt. So I'm Andrew Spears. I'm the strategic lead for research and analysis at Sport England. I guess specifically in relation to the session today, although I have a wider remit around obviously our research and analysis and organisation, I was the Sport England lead on the social and economic value reports that we worked on with Larissa and her colleagues at the Sports Industry Research Centre.
Hi, my name is Larissa Davies. I'm a reader in sport management at Sheffield Hallam University. And as Andrew mentioned, I led the team of researchers here at Sheffield Hallam for the piece of work that we're going to discuss today. So without further ado, Andrew, shall I share my screen and we can kick off?
Thanks, Larissa. So Matt asked us to cover a few questions, I guess, to give a sort of overview of perhaps the context and the background to why the work was commissioned, its importance, and then I'll hand over to Larissa to talk about perhaps some of the more technical aspects of the project before coming back to myself. So why was this work commissioned in the first place? Well, this specific report was commissioned following some discussion with DCMS, who wanted information really to support the most persuasive case possible to Treasury as part of a comprehensive spending review bid. They wanted something that spoke to the overall public value of sport and physical activity in a way that was credible and convincing and spoke the language, I guess, of government economists. But I think it's really important to set this in a slightly wider context and make the point that this report is just one part of an ongoing programme of work that we've been pursuing. So we've at Sport England and with colleagues and partners across the sector have been working on the evidence base around the value of sport and physical activity for quite some time. And whilst I'm sure it's possible to trace a much further line back in history and do it in much more detail, I thought it's just important to perhaps talk about some of the key bits of information that certainly have been pivotal for me as we've gone on this journey. So the first one I'd talk about is actually a major systematic review of the social impacts of sport and culture that was completed back in 2014. This was actually a report that gave us, I guess, the sufficient confidence that actually attempting a social return on investment model, which is a key part of the research we're talking about today, would be feasible. Then in 2016, Larissa and colleagues at the Sports Industry Research Centre produced that first social return on investment model. Around that sort of time, we also had the publication of DCMS's Sporting Future and Sport England's Towards an Active Nation strategies, which both put social and economic value firmly at the heart of sports policy, and also gave us the structure of the 5 outcomes that we've used to organise a lot of the evidence base that we now do. So those being physical well-being, mental well-being, individual development, social and community development, and economic development. Then in 2017, Sport England published our Sports Outcomes Evidence Review, where we sought to organise the largely academic published research, but also some grey literature against those 5 outcome areas. And that's something we're planning to certainly release an update on in the near future. Then if we switch to perhaps economic value, Sport England have commissioned various economic value reports and tools over the years. And obviously DCMS have overseen the regular production of the sports satellite accounts. So this latest report is a very important, but it is an addition to a developing and ongoing body of work around the public value of sport and physical activity. And why is that important? Well, again, the specific importance of this report is I think that it provides the latest, and I would argue the best overall picture we currently have of the public value of community sport in England. It's organised against those 5 outcome areas that I described are set out in Sport and Future. It builds on previous work and draws on the latest evidence we have. It was developed in close collaboration with a range of government departments and bodies, and also drew on not just the expertise of Sheffield Hallam University, but a range of other academic experts. It's also, I think, the first time we've sought to combine social and economic value in a single output. And this work, which I'll come back to later, has been carried out in line with a set of principles that we hope can guide further and wider work in this area. But again, if we zoom out, this report is part of a wider body of evidence about the value of sport and physical activity that I think is essential to making the case and advocating for sport and physical activity. I'm sure everyone tuning in this afternoon believes in the value of sport and physical activity, but I'm sure we're all also challenged to provide evidence to support that from time to time. So whether that's Sport England and DCMS making the case to Treasury, whether it's sport and physical activity colleagues in local government making case to their members, or community sports organisations and businesses bidding for funding. The report that we're talking about today and other related work all help us to make those arguments with more confidence. And I think being able to make those persuasive arguments about the overall value of sport and physical activity is absolutely key to us not only protecting, but hopefully growing the resource base for sport and physical activity. Something that means we should be able to offer increased opportunities for people to engage in sport and physical activity in an equitable way. So hopefully that's a useful scene setter. I'm now going to hand over to Larissa to talk more about perhaps some of the detail of the report.
Thanks, Andrew. Within this short presentation, and obviously the purpose of the session is to have the opportunity to discuss questions and respond to those questions. So we're just going to, or I'm just going to give a very brief overview of the work and of the research that we carried out for Sport England. And I would just encourage you, if you are interested, to look at the more detailed reports on the Sport England website, because clearly we don't have the time to go into the minute detail here in this presentation. So, as Andrew mentioned, the aim of this piece of work was to quantify both the economic and the social impact of community sport and physical activity, And this is certainly the first time that this has been done in England. And as a holistic piece of work, the aim was to try and get a much broader estimate, a broader sense of the value of the sector more widely within society. There were two complementary parts to the research. There are two separate reports that detail the methodological detail behind the work. The first part was focused on social value and adopted a social return on investment framework approach. And the second part was focused on economic value, and it adopted a national income accounting framework, which, as Andrew alluded to, is a framework that we've used to, or has been used to, measure economic value across a number of years. So I'll just talk about the first part of the research, the social value part initially, and then talk about the economic part after that, and then come back and look at the findings holistically, and then that will lead us nicely into Andrew's discussion of the principles you mentioned a moment ago. So for this part of the research, we valued the benefits and costs of sport and physical activity for which no financial transactions take place. So those wider impacts that are quite difficult to put a monetary value on. We used, as I said, a social return on investment framework, and we built, as Andrew quite nicely summarised in the introduction, we built on both previous evidence reviews that have been done on the wider social impact of sport and physical activity, particularly the significant review that we did with DCMS in 2015, but also on an earlier model or social return on investment framework, pilot model, if you like, or initial model that we did in 2014. And the framework that we used, the SROI framework, the social return on investment framework, is a standardized framework and a recognized framework for measuring non-financial benefits and costs of activities. It's developed from cost-benefit analysis, sustainability accounting, financial accounting models, and it is widely used beyond the sport and physical activity sector, particularly in the charitable and third sector. So we've seen a growing use of this framework, certainly within the sport and physical activity sector in recent years. So that's the framework that we adopted for this work. The outcomes that we included in this model were evidence-based, so they're certainly not the only outcomes that sport and physical activity generates, but they're certainly the ones that we could link strongly back to a robust evidence base. There were 16 outcomes that we measured in total as part of this piece of work. 10 of those outcomes were related to mental and physical health, largely clinical outcomes. We measured mental well-being in relation to subjective well-being. We measured 2 outcomes related to individual development and 3 outcomes related to social and community development. And as I said, the outcomes we selected were based on the evidence that linked activities or engagement in sport and physical activity with outcomes. And we also used a range of different valuation techniques to measure those different outcomes. I don't really have the time to go into those now, but perhaps if that's of interest, we can explore that further in the Q&A. In terms of the scope of the work, we included participation and volunteering, but we excluded major sports events, largely because they were beyond the remit of this work and the scope of the work, really. We focused on the year 2017-18 as the year for which we had the most complete set of data. And we focused on the population of England, children aged 10 to 15, and adults aged 60 and over. And within the scope, we were guided by the definition of sport and physical activity adopted by Sport England. So in terms of the headline findings in relation to the social value part of the work, you may have seen some of the headline figures in the media and on the Sport England website. But overall, we put a value of £71.6 billion of monetary value equivalent monetary value generated through the 16 social outcomes that we measured. As you can see from the slide that we have on the screen, a large amount of that impact on value was generated by the subjective wellbeing component of both participation and volunteering. And that was approximately, or came out to be approximately 58% of the overall social value that was identified through this work. Social and community development was also an outcome area that we found generated a significant amount of monetary value. And you can see from the figures on the slide there that mental and physical health generated approximately £9.5 billion worth of monetary value. I think it's worth noting at this point, this may well be a discussion point a little bit later, is that the value that we placed on individual development, I think certainly from my perspective and interpretation, reflects really the lack of evidence we have in relation to that outcome area, rather than the small value that's contributed in that area. So I think that perhaps stands out a little bit, but I think that's explained by the underpinning evidence that we used to create the model. So moving on to the economic value, the economic side of the work that we did. As I said earlier in the presentation, we used a national income accounting framework to put a value on the financial benefits associated with sport and physical activity. And as I also mentioned, and I'll come back to this point in my concluding comments, economic valuation has a much longer history in terms of evaluation and monetization. Historically, it's been the indicator used to value the sector, and this work goes back to probably the early 1990s. So the key indicators that we used are those that have been used previously. So we looked at consumer spending on sport and physical activity, we looked at gross value added, and we looked at employment. And in relation to the scope, this part of the study actually did include participation, volunteering, and spectating, but we pulled out and separated out the community participation element to enable comparability with the first part of the project, and to be able to put a more holistic value on community sport and physical activity. And again, just pulling out some of the headline figures from that part of the research, we found that sport physical activity generated 285,000 jobs, and in terms of the overall sector, 60% of those were in the community sport and physical activity part of activity. We found that employment had increased 9% in the sector since 2010, and overall we found that 2.4% of all jobs in England were related to community sport and physical activity. In relation to gross value added, we found that the sector was worth 13.8 billion, and we found that that was approximately 1.6% of national gross value added in England, which is broadly comparable to what we found in 2010. I think it's worth reflecting on the combined overall value of the sector, because that was certainly something that was a unique part of this project, in being the first time that we looked at both the combined social and economic value of community sport. And we found the overall monetary value was in the region of 85.5 billion. What we did as part of this work is we also looked at the costs or the inputs required to generate that value, and we found, which is the infographic on the left-hand side that you may well have seen when we released the work, is that for every £1 spent on community sport and physical activity, there's a return of £3.91, or rounded up to £4 return to society. And I think what this research has demonstrated is that sport and physical activity generate significant and positive value to society. But what it also demonstrates is that previous estimates of the sector that have focused just on the economic value have significantly undervalued sport and physical activity. So I think what this research does is certainly highlight the importance of measuring and monetizing the wider sector, and it certainly provides the ability to then communicate that to a wide range of stakeholders within the sector. So what I'd like to do is to hand back to Andrew now, who's going to summarise our formal part of this session.
Thanks, Larissa. So alongside the report, I think as we've mentioned on a couple of occasions already, we published a set of principles that we felt were good principles for people contemplating doing a similar piece of work. I'd start at the outset by saying these are not principles that Sport England develop themselves. They are fairly shamelessly lifted from the principles of social value that have been developed by Social Value UK. I also hope as I go through them, they feel quite comfortable and make common sense to people as I talk through them. I guess perhaps just useful to reflect a little bit on why we actually produce some principles alongside the report itself. And there are a couple of reasons why we did that. The first, I think I certainly have a few often connected pet hates about certain value models that are developed. The first would be what I describe as sometimes the sort of black box reports that you sometimes see that present you with value, but provide little or no detail on how it was arrived at. And I think often accompanied with that is models that I feel make slightly heroic valuations or assumptions at times. So they can quite often be based on perhaps lower quality evidence, and some of the assumptions made can be optimistic. And I think, in my opinion, doing it either or both of those things in a model can actually sometimes do more harm than good. It can lead to valuations that aren't credible and are likely to fall over when they're scrutinised or challenged. It can provide value modelling approaches which become essentially an exercise in who can generate the biggest value, rather than really trying to genuinely reflect on what some of those values are. I think it can also shut down discussion and development, because often they don't talk a great deal about limitations, gaps in the evidence base, things that it would have been great to have had when we build a model, or will be great to have when we next build a model, to make sure they're better and stronger. The other thing I think we felt was important when we put these principles out there was what we didn't want to do is present our report, or the report we worked on with CERC, as the last and final word on social and economic value. I don't think it works that way. We want people to do more work, we want people to challenge, we want people to discuss, we want to develop in this area. And we didn't want to be overly prescriptive and say exactly how we felt future value work should be done. Again, I think that shuts down discussion, debate, and development. However, we did think it was important to make some overarching points about what we thought were good, relevant, and defensible ideas, approaches to creating a value model and what one might look like. So as I say, hopefully the principles, which I'll run through in a moment, are useful and will help lead us as a sector to presenting a more coherent, complementary and persuasive picture of value. So the principles that we've set out, which are on the screen there, first involve stakeholders, and that will often include Sport England and other bodies, and agree the scope of the project with them. Identify those that you know will have an interest in the project and involve them throughout it. Discuss and agree the scope of the project with them, what it'll include, what it'll exclude with those stakeholders. Second, have a good theoretical basis for the model. Could be a theory of change, logic model, or something equivalent to that shows the relationships between the inputs, activities, outputs, and outcomes that will go into the model. Once completed, test that model with your stakeholders. And a good model should really help you identify and hone in on the things that matter most and you want to value most within a model. Third, do not overclaim. We think it's really important to consider the quality of the evidence for inclusion within the model. And certainly discussions I had with Larissa, I think there's a sense that we feel one should focus on good quality evidence, even if that means a slightly narrower focus to the scope of the study. And when it comes to calculation of value, be prudent and do it in a credible way. That will certainly put the model in the best place, when it does get looked at and scrutinized by others. And in a similar vein, principle 4, transparency. It's important to communicate the methodology, the assumptions, be open about the calculations and the way those have been derived, and also the limitations within any model, the gaps in the evidence base, the limitations of some of the techniques applied. Again, really important there that we're open and honest about those, not just when people are reviewing the model, but where we go from there. And then fifth, verify the result. So seek external validation of the modeling approach and results. That will increase the credibility of the model, and also, importantly, identify areas for further improvement and development. So it's my firm belief that if we follow these sorts of principles, we have the best chance of producing complementary models of value that can combine and create a more complete and compelling picture of the value of sports and physical activity, and build to that body of evidence I've referred to on a few occasions. I think also this idea around being honest about the limitations also helps us have that mature and sensible discussion about the evidence which will guide future research on around sport and physical activity. So I think that's everything I wanted to say. I think if we hand back to Matt now, I think we can pick up on any sort of questions, follow-ups that you have for us.
Thank you very much, guys, for that really informative presentation of the social value work and the significant value that this has for society, and the level of information, and also setting out at the end those important sort of principles for good research. I think we definitely worth touching upon them perhaps in the panel with the wider group later. Yeah, so got a few questions I'd like to ask. First off, use the term sport and physical activity. Could you just expand sort of what we mean by that broad term, and sort of what activities and facilities might be included within that term?
Yep. Shall I field this one, Larissa?
Yep, go for it.
I mean, Larissa mentioned this in her presentation. So I guess the key metric that we use, certainly within the model or the social model, the social value model in this particular report, is what I would describe as the levels of activity measure that is probably the headline measure that we publish in Active Lives reports and various other things. So this is actually a very broad definition of sport and physical activity. So it includes what you typically describe as traditional sports activities, but it also includes walking and cycling, both for leisure and for travel, dance, health and fitness activities. So I guess that's the range of activities that are covered. And then I guess building on that, Matt, essentially anywhere those activities could take place, which is pretty much anywhere, I guess is incorporated within this model. There is, I guess, some discussion, and perhaps we'll come onto it later, on how we might develop iterations of similar approaches that perhaps focus in on specific facility types, settings in which physical activity might take place, where we know it's important to have specific value arguments, contribute to case making, and the development of, I guess, strategic plans for the development of sports facilities, infrastructure, whatever it might be.
Yeah, I would just add to that that we did adopt that broader definition of sport and physical activity, working obviously with Sport England on this. And one of the, I guess, the more groundbreaking parts of this work was that broader definition and the inclusion of active travel, particularly for the valuation of the health outcomes. So I think it's important to really make the point that this was a much broader scope than certainly the earlier work that we've done in this area.
Fantastic, yeah. So it's sort of quite all-encompassing as much as possible, but might be some areas that we can continue to, like you say, this is iterations of this work, and it's continued to build and develop. That's fantastic. Larissa, you spoke about some the 16 sort of outcome measures, and one of them in particular, the individual development, and you talked around how that it's not necessarily it's a small value, but there's a lack of evidence. Mm-hmm. Sort of some of these terms might be a little bit abstract. In terms of individual development, what does that actually sort of mean, and sort of what kind of measures might we be looking at for individual development? So then how can we then increase the evidence around this outcome?
Sure. Well, if we look at the Sport England definition, the Sporting Future definition of individual development as an outcome area, we're looking at things such as improved educational behaviour and attainment through greater self-esteem, confidence and cognitive benefits. That's broadly what this outcome area is about. But how we've operationalised that in terms of the model is obviously evidence-driven and evidence-based, because we don't necessarily have the evidence to identify each of those components of individual development. So in the context of this model, the two outcomes that we included were educational attainment, and we used GCSE performance, A-level performance as proxies for that. And we also included what we called enhanced human capital, which was essentially the additional salary or income earned by graduates who take part in sport and physical activity. So they were quite specific, again, based on the evidence that we had in those areas.
It's fantastic, yeah, really, really useful. And I think just touching upon something we mentioned a few times around this sort of development of the work, you know, we talked about some of the work previous, and this data is obviously from 17, 18, because that's the most complete data set that we've seen. Can you just touch a little bit on the trends that you might have seen? I know that there's been some sort of iterations and evolving of the work, but any trends that you've seen since that early work? And I don't know if you're able to maybe sort of touch upon what trends might be looking forward, especially in the current situation that we're in. Are we, you know, how would we project that forward from 17, 18 to current day?
I think, Andrew, shall I just wanted to make a general comment about the way that we've done this, and then that might lead on to some points that Andrew wants to make. But I think it's important to realise that this research is essentially a snapshot of value in 27-18. Even on the economic side, when we have studies going back, there are methodological differences between those. So we don't necessarily have a time series or data that goes across a period of time to comment on trends. But I would say that the model is driven by participation and engagement, so in both participation and volunteering. So as participation trends change, increase, decline, so will the social value. So that's the major driver of the model, but then there's obviously the evidence that demonstrates the link between the activity and the outcome. So I think I would caveat this by saying this is just a snapshot, but Andrew, you might want to perhaps comment on trends and how that might influence, you know, if we did future iterations of this model.
No, I don't have a huge amount to add, Larissa. I think you've captured probably the two key points there really well. I mean, as Larissa says, we have iterations of models over time, but the differences you primarily see in the value there, I think, is actually the scope and the breadth of the model and the approach taken to them, perhaps more so than we've discovered the value of sport in mental well-being terms has gone up or anything. I mean, it may have, but I think it's difficult for us to say with confidence on that side of things. And the key thing that is driving differences in value that might go up and down over time is actually the number of people that are getting a dose of sport and physical activity, as it were, and therefore getting the benefits of it. And I think the thing I would draw people's attention to, possibly within the detailed report for the social value in particular, was a forecast model that we asked Larissa and the team to develop alongside what we call the base model, which is that snapshot in time. And this was an attempt to certainly think about if certain scenarios were to occur, certain growth scenarios, certainly, which were primarily related to targets that were in Sport England's strategy, what would the value of that be to society? And I think particularly you asked, Matt, about, you know, this current situation we're facing, whereby we're, it's very challenging in terms of, it's much more difficult to be active. Parts of our sector are under considerable threat. What is the potential cost of a contraction of reduced levels of engagement? And I think that the model can help us do that. And we haven't attempted to put a figure on that per se, but I think it's fairly clear. And the way the model speaks about value and the way Larissa talks about it is driven by participation. Fewer people taking part in sport means fewer people enjoying the benefits, and fewer communities enjoying the benefits that sport and physical activity can bring. And that's bad for us all.
Absolutely. Yeah, Yeah, definitely. That's really useful. Thank you. Looking now sort of a little bit on sort of the operator and people actually delivering it, should everyone be measuring this social value, this kind of information? And how can individual operators, providers, activity suppliers, etc., use this information within their sort of day-to-day workings?
Shall I go on that, Larissa, first?
Okay. By all means.
Yeah, I mean, I think my honest reflection on that one, I don't think it probably is necessary or realistic to expect everyone to measure social value in everything they do. I think frankly, the burden of doing that will be disproportionate for some projects and in some instances. I also think we have, through the evidence base we have, some of the models we have potentially the ability to infer value where we've got very tried and tested models of delivery. And I think that's something we can do. So I would argue and I would advocate where we've got something that's new and novel and we've got something to learn from a project that's real. And we're certainly, it's premised on the fact that we want to drive a particular value through it for individuals or communities or whatever it might be. That's where I think it's really important to try and consider and try and measure social value as best you can. But I don't think it should be mandatory in all instances. I don't think that's a reasonable expectation to have, and I don't think it's always strictly necessary.
Yeah, and I think the only thing I would add to that is it also depends on what organisations are trying to achieve by measuring social value. So is the purpose to prove evidence impact, to justify investment, to bid for new funding? So again, it depends on the objectives of the organisation. And it also, depends on, the wider purpose, really. So if an organisation has health and wellbeing objectives at its heart, then that might be more important for that type of organisation to others.
Fantastic. And now sort of moving away from sort of like the individual providers and operators and moving to sort of a more sort of broader approach. With these findings that are so powerful for our sector, what would your recommendations be to government policymakers from this report for things moving forward?
Do you want to go first?
I mean, I think. Thanks, Larissa. I mean, I think what this piece of work and other bits of work that we can cite and we've referred to over the course of the session, that clearly demonstrate there's a great deal of both what I would call intrinsic and instrumental value of sport and physical activity. It can it can be incredibly enjoyable and fulfilling to individuals, but it can also improve the health of the nation. It can improve, it can generate jobs. It can drive economic outcomes. It can strengthen communities. It can improve, as we discussed earlier, people's employment prospects and future earnings and a whole range of other things, or educational attainment. And the research also proves that there is a positive return on the investment that we put into that. And the input figure Larissa talked about, that's not just public money going into the sport and physical activity. That's private consumer expenditure as well. And even when we take that into account, every pound we spend on sport and physical activity, we get £4 back. So yeah, I think hopefully the argument for the value of sport and physical activity is clear, and therefore the need for us to support it, drive it, improve, and drive and grow levels of engagement in equitable ways, is the key thing to take away from here.
Yeah, absolutely, and I would support those comments. I think what the research shows is that sport and physical activity really does demonstrate significant value to society across multiple outcomes simultaneously. So there are arguments to suggest that makes it a cost-effective intervention. And I think it's clear from the research that it's important for the economy and the wider society to have a healthy, happy, well-balanced society. Participation engagement in sport and physical activity drives that. Therefore, the message and the recommendation has to be to support and invest in those opportunities to make activity available to all. So those would be, I guess, my recommendations based on the findings. And I think then from a research perspective and as a researcher, I would probably recommend that this type of work is updated periodically, certainly, and to incorporate the latest evidence. I think one point that I probably should have made and meant to make in the presentation was that this is a conservative model that values sport and physical activity. And as more and better evidence becomes available, we can, update it, improve it, and identify value more accurately, I guess.
That's fantastic. Yeah, I totally agree with the demonstrating the value that our sport, physical activity, wider sector has for the health, physical, mental, emotional, etc., well-being of the population and our sector, and can actually support that. And just thinking on sort of that government message, just one final question before we'll go for a break. Are you guys aware of any other reports from outside of our sector, maybe in some of the sectors that the government have been supporting recently with some of the things that have been going on with COVID, in terms of like the retail sector or hospitality sector, where they might have done a similar work around social or economic value or return on investment? Are you aware of anything that as a benchmark or a comparison?
It puts us on the spot there a little bit. Haven't done that bit of research. I'm not aware specifically of any similar studies, but I think I would probably add a note of caution around trying to compare across sectors, whilst I think the desire is often to compare the £1 to £4 return to the £1 to £3 return we might get from retail. But I think this is why the transparency of method is very important, because how things are included and how things are valued and measured is not always equal. So I think it's always quite difficult to do those sector comparisons that perhaps you're suggesting.
Yeah, I would agree with Larissa wholeheartedly on that. I mean, I think, yes, there are definitely other models out there that Matt, social housing and various others that we know exist. I think what we've tried to do is avoid the temptation to get into a sort of beauty parade whereby we try and aim for a better value or benchmark than someone else, and really focus on what we felt was the best and most authentic and complete valuation of our sector. And as Larissa's pointed out, within that, acknowledge that there are some areas there where probably the valuations are really very conservative, because we haven't quite got there with the quality and breadth of the evidence we'd like in some of those areas. And I think that's a really important message to us. That's certainly where I'd like to put more energy in over the coming years, building our evidence base better and better. So the next time we do this model, it's more complete, it covers a greater range of benefits, and that will almost definitely increase the value that we're able to report for sport and physical activity.
Yeah, that's great to hear the ambitions for future work around this. And just finally then, where's the best place for people to find the report if they wish to do some further reading? Is it on the Sport England website? It's
all on the Sport England website, yep. I could share a link to the page, but it's there's a page around essentially how can we help, and it's around measuring impact, and there's actually a great range of resources on there, and this report's absolutely one of the central ones.
Fantastic. Well, Larissa, Andrew, thank you so much for that really insightful presentation and discussion. Really appreciate it. So now if we just break for 5 or so minutes, 44. So if we come back at 2:50 at 10 to 3, we'll reconvene with the afternoon panel session. Hi everyone. Hopefully you've all managed to go for a break. I think it's now time to move on to the second part of today's session, which will be a panel session where we'll be looking at measuring and creating effective interventions in health. So as I mentioned at the start, Andrew and Larissa will be joining us from the first part, and we'll also be joined by Jess and Lawrence for this part. So to start with, Jess and Lawrence, could I ask you to just provide a bit of an introduction to yourselves for those of you that don't know you? Maybe Jess, if I pass over to you first, please.
Sure. I'm Jess Kuna. I'm the Senior Program Manager for Healthy Aging at the Center for Aging Better. And we are an organization, we haven't been around for that long yet, but we are a research organization, but we also work with stakeholders to try to influence policymakers and practitioners. So we're part of the government's What Works Center, so we promote the better use of evidence in policy and practice. And one of our key areas of interest is healthy aging, and within that, physical activity is a huge priority for us, because we know that as people grow older, they tend to become more physically inactive. So there is a huge age gradient when it comes to becoming less and less active as we grow older.
Fantastic, Jess. And Lawrence?
Good afternoon, everyone. So yeah, I'm Dr. Lawrence Mowather from Liverpool John Moores University. Our research group, the Physical Activity Exchange, we essentially conduct research that evaluates interventions to increase activity or reduce essential behaviour across a life course. So anything from design interventions, developing interventions, testing them and evaluating them against behaviour change outcomes is kind of what our core business is research.
Fantastic, thank you. So in this session, we'll go through a number of questions and topics. And as I described at the top, it's about going from that data collection side of things right through and translating that through to policy and practice. So to start with, I'd like to ask, maybe I'm going to direct this to you, Lawrence, first off, and then the others, it'd be great if you could jump in afterwards. But how have you used data to understand effective interventions within your field?
Okay, so a lot of my research is primarily with children and young people. So essentially, you know, if we're doing a project that's trying to increase physical activity, then we'll try and use device-based measures. So things like accelerometers or pedometers or step counts to quantify activity measures, particularly because in children, you know, they can't recall activity data very well. In larger studies, we might need to do more self-report measures, questionnaires, and then in younger children, we might use parents or teachers as a source of information to tell us about activity levels. But alongside that, really not just around, you know, the behaviour itself, we try and look at factors that influence behaviour. So we'll do a lot of work around understanding, for example, motivation, confidence, the individual determinants of activity, but also maybe try and understand the contextual factors, like, for example, the school environment, the school policies, the culture in the school around physical activity, the opportunities that a child has for outside of school provision for activity. That alongside, if we're going to look at health markers, it can be anything from a field-based health marker, such as a fitness assessment, to more lab-based work where we might do things like physiology-based measures like heart scans and body scans. So kind of a lab to community-based data collection approach, really.
That's fantastic. Maybe Jess, could you expand on how, obviously you're working on the opposite end of the scale with the older population. Is there any similarities there of how you use data with the populations that you work with?
Yeah, so we often use data to try to better understand the problem, to try to work out what's happening, and then design different approaches or make policy recommendations. So just to give a recent example, we recently did a project with Ipsos Mori to better understand how people in their 50s and 60s, so what we roughly term midlife, have been experiencing the pandemic. So focusing on homes, community, health, and work. And we did a literature review followed by a representative survey of 1,000 people, and then also did a longitudinal qualitative research with 19 participants to give a bit more in-depth analysis. And it's this kind of using different types of data, because just looking at secondary data or just looking at qualitative data isn't going to give you the whole story. So piecing together multiple different types of data to tell a bigger story, and to really figure out what's going on. And we often use data to bring out, to put an aging lens on many issues. So physical inactivity is a perfect example. The way that physical activity levels change across the life course. And data is also really important to use to look at who is most likely to miss out. So it's actually an important point to make, that oftentimes a lot of the data that is collected is not collected in a way that allows you to draw a conclusion about groups that are less likely to be engaging in physical activity. So, for example, women are slightly less likely to engage than men, people from certain ethnic minority backgrounds, older adults, people with health conditions. A lot of times when we look at research and we look at data, we need to make sure that we're collecting enough data on these kind of underrepresented groups so that we can draw conclusions about them as well.
Absolutely, it's making sure that those groups are well catered for, and we're using that data to provide the evidence. And I know that's Andrew, I could see you nodding along to that statement. Is there anything sort of from the Sport England side that you'd like to expand on that point?
No, I mean, I think I'd echo a lot of the things that have already been said. I mean, we, I guess, do quite a lot of population-based tracking and surveillance at Sports England through things like the Active Lives surveys. That gives us the sort of state of the nation picture, but it's in terms of understanding effectiveness, which I think was the original question, Matt. I mean, that's really where we focus our evaluation work, which is absolutely central to this. And you know, the range of perspectives, techniques that both Lawrence and Jess have spoken about are very familiar to us. I think what we've tried to do is, you know, adopt good principles wherever we can, but I think there's always a tension between that and not overburdening people that are recipients of our grant funding with too much of a burden. Some people possibly on this call perhaps think we sometimes get that wrong, but we are mindful of that, and we are trying always to strike the right balance between not measuring things to death or in such a way that gets in the way of the intervention itself, but also you know, the need for us to learn and the need for accountability in the way we distribute and use our funding. I think the other key thing, and I think again Jess spoke to this a bit, and I'm sure Lawrence would agree, and others, there's something about drawing kind of perhaps more universal learnings across the body of work that we all do, which I think is really important as well. So you know, I think that's where we become smarter and we do things better, where we understand that actually there are key characteristics which seem to come back again and again in successful interventions, and those are the things that are golden and we need to sort of scale up and do more of.
Absolutely. Larissa, just opportunities, anything else you'd like to add from the data you discussed just now?
No, well, just to say really that we take the data from organisations, Jess, that Lawrence talk about, we take that research and then we use that data to monetize and place a value. So really that type of evidence that's being discussed is critically important to feeding into social return on investment analyses, whether that's at the population level or whether it's at a more local level, at an intervention level. So that underpinning evidence is without that we can't monetize value.
Can I just jump back in, Matt? Is that okay?
Please do. I
was going to say as well, actually, I think process evaluation data is really important. So often what we see is that people jump ahead and do an effectiveness evaluation too early. And for me, actually, it's more important that you actually understand that what your program or your intervention is working in the way you intended before you actually go on and measure evaluation effectiveness itself. So that black box that Andrew, you mentioned before in the last session is really important to know what's going on in that black box. And sometimes we might dismiss an intervention or a program as being not effective, whereas actually what happened is it wasn't delivered correctly or as it was intended. And so that process evaluation data is really useful to help learning, improving the program, and then we can look at effectiveness up to that point.
And can I just add a point to that is also when thinking about process evaluation is to make sure that you're building it in from the start. So, or any type of evaluation, when you're designing an intervention or an approach, it's really important to think right at the beginning, how am I going to measure this? How am I going to evaluate it? And not waiting until the middle or waiting until the end to say, oh, okay, let's now collect some data and find out what has happened. So, I mean, just to give you an example, so the Department for Transport has given all this money for emergency active travel measures that have been introduced within a 10-week time span. And from conversations that we've had with local areas, a lot of them have not been evaluating that, which is understandable. 10 weeks is a very short time period, and people made, I mean, it was in the name emergency, very, very quick changes in a very short amount of time. But at the same time, kind of lost an opportunity to think about, okay, should we have gathered any sort of data at the beginning to see what kind of impact or changes this would have made along the way?
Absolutely. So where yeah, I totally agree about getting sort of evaluation and data collection embedded right from the start. It makes things much easier. So how can someone running an intervention or an activity provider, operator, supplier, for example, how can they work closely? How do they get in contact with research groups such as ourselves, or charities or other businesses or academics? And how does that sort of conversation get initiated, and what are the sort of the first steps in sort of collecting that comprehensive data? How would it work in sort of reality? Jess, do you want to open to anyone to start?
I mean, I would almost put this to Andrew, because Sport England has done a very good job of, when they give out grants, of requiring their fundees to collect data from the start, and often asking for programs to pair up with academic partners to think about how they're going to evaluate what data they're going to collect. And I mean, I would just say, yeah, the best way to do this is to really systematically think about what data you can collect where possible, where GDPR allows, where consent has been taken, to get a good picture of the individuals that you're working with or that you're trying to affect change for. So across sex, across age, across ethnicity, across health and disability status, and also thinking about what outcomes you're measuring for. So is it health outcomes? Is it physical activity levels? Is it something monetary? So thinking about all that stuff from the beginning, and seeking advice from academics, from research institutions.
Yeah, I mean, thanks, Jess. I think that's a really good overview. I mean, I think a lot of people will associate Sport England's evaluation activities perhaps with some of our funding programs, and we do try and do all those things you've described. And I would say a shameless plug, which I think mirrors the kind of process you described, would be our evaluation framework, which really tries to kind of talk people through this process and how they can do it in in a proportionate but good quality and hopefully consistent manner. And that does inevitably mean, as you say, drawing in key partners with key bits of expertise as we go through it. But yeah, hopefully more generally, Sport England and other partners are there to help, not just when there's a funding agreement being put in place, but more generally through the networks we create, the conversations we try and convene and broker to support people to do this kind of work, even where we're not perhaps directly funding a project. And I'd certainly encourage people to use our website and look at some of our resources to see if they could help in these sorts of situations. I also think that there are lots of good examples of working with a wide range of partners. Things that spring to mind, Sport England's certainly work with the Richmond group of charities, who perhaps not always a group of stakeholders you might imagine would work with a range of commercial partners, Federation of Small Business on some of the workplace interventions. There's a lot of stuff going on here, and I think some of those partners we might draw in can add real value. They bring new perspectives, new expertise, trust with new audiences quite often as well. So all of that's really important as well.
Absolutely. I was wondering, Lawrence, maybe sort of around that sort of working with academics and sort of practice to academia. How you talked about a couple of different measures of device-based measures, questionnaires. How do you upskill those that might be needing to them, or how do you make them aware of why the devices or the questionnaire might be needed, and what are the key sort of steps you take to making sure that the data is collected in an appropriate manner?
I think that the key is, first of all, it's about a feasibility accuracy kind of trade-off, really. So whereas we would prefer the best possible measure of activity, and that might be more device-based because it can tell us about, for example, timestamp data, intensity data, and so on. Often in larger programs or surveillance data, like Andrew speaks of, survey data is really the kind of way to go, really. And I think one of the things we stress is often about how changing survey questions can change the validity of the survey itself. So for example, what we might see as a program or organization might want to reduce the length of the survey to make it more feasible for them to administer. And I can understand why they do that, because they don't want to put a burden on participants. They haven't come to the session to complete the survey, they've come to take part in an activity. So I think we've got some work really as research and evaluation support to try and ensure that we develop measures that are really feasible and reduce the burden on both the deliverers and the participants themselves. But equally, we need to kind of help to support organisations to be aware that changing things like the question wording does actually change the validity and reliability of the survey itself. And therefore that has implications for how we share the data with people, for example. So yeah, there's some issues there, but I think it's just making people aware that there are consequences to some of these little changes and actions.
So it's sort of a trade-off between the reliability, validity of whatever measures are used versus the application and feasibility of actually running that in practice. And obviously the main aim, like you say, is they might be turning up to a session. That's the aim of what they're doing. They're not turning up to undertake research. And it's finding that it's a fine balance between data collection and overpowering on a research sense. Yeah, definitely. And I think that this is why actually prioritizing your outcomes for evaluation is really important. So you don't want, you might think that your program's targeting a huge list of different outcomes, but it's not feasible to measure all those outcomes. So what are the things that you think your program is most likely to change? And they're the things you should be measuring really, and try and keep it simple. And as Andrew and Larissa said before, getting good quality measures in fewer measures is better than poorer quality measures across a wide number of measures. Absolutely. And on that point as well, and Larissa touched upon where sort of taking data from all the different programs to put money towards it. And it was talked about the universal learnings that we'd like to try and gather from all the work that we're all undertaking. How can we encourage sort of uniformity across the work that we're all doing in the wider sector to sort of encourage that shared learning? With lots of different measures, lots of different like questionnaire or questions or approaches. So yeah, how can we encourage uniformity across the sector and data collection? Is that for me or? Open to anyone who wants to go for it, Lawrence. I was going to say, well, things like if we give people resources. So what I mean by that is we can give people tools to use. So if we can actually say, here's a survey for this, here's a survey to measure community cohesion, for example. So if we can actually offer a resource bank of tools, then at least we can hope that we know what tools people are using and can standardize it in that way. But I think it's really important, similar to the principles measured in the last session, that it's about getting all the stakeholders around the table and agreeing kind of a standardized outcome format, really. That's probably where I'd start. Yeah, and again, I'm going to refer to Sport England here. Sport England already has a lot of really great resources for anyone thinking about evaluation. So on their website, Andrew, maybe you can say more, because I've definitely referred people to you who have been thinking about evaluation and maybe haven't had the resources, to hire a full academic team. There are kind of lighter touch ways to think about it.
Yeah, I mean, thanks for the plug, Jess. But I totally agree. I think the evaluation framework resource in particular, which has nestled within it a range of other resources, is really good. And this is not, purely Sport England's kind of view of the world. These are things that we've drawn on from a range of, expert evaluators from across a range of sectors. They're hopefully useful, harmonized, standardized definitions of perhaps certainly how you might capture certain demographic data, those sorts of things. But within that, and I think this is perhaps another tension we need to speak to in the same way we talked about the trade-off between, the burden of measurement and the quality of measurement that we sometimes have to strike the balance between. Yeah, I mean, me sitting in a national central role, I would love everyone to collect their data in exactly the same way, so I can put it into a mincing machine and it spits out some kind of definitive overarching aggregated value for all of the sport physical activity interventions going in the country. That's not a reasonable thing for me to expect, though, when there are such a diverse range of projects, partners, stakeholders. So it's striking a balance between what's proportionate, what's reasonable, providing resources which people can access in different ways at different levels, depending on their capacity, their expertise, their resources, the partners they might be working with. So there's a real, yes, the more consistent we can be, the better. I think the more coherent and comprehensive our kind of learning and our message will be about the value of sport and physical activity. But equally, there are, unique characteristics and factors playing out across the country that we need to be sensitive and mindful of as well.
Yeah, and I think whilst there's a desire perhaps for some level of consistency, I think uniformity doesn't always push the boundaries of knowledge creation. So if we always do everything the same way, we don't create that new knowledge that we require to then be able to evidence outcomes that perhaps we haven't previously evidenced. I think for me, the issue is more around the transparency of method. So what methods are used, why are they used, and how is the data being collected? And that enables then an informed judgment of the evidence and the quality of it. So for me, it goes back to one of the principles that Andrew talked to earlier around transparency of method and data.
And that was going to be my next question. So fantastic bridge was, how can we foster that culture of open, transparent sort of data collection, data sharing to sort of help our collective cause?
Perhaps I could come in on this one initially, Matt. I mean, I think there are some practical things, and I would argue this, what I might describe as some cultural things as well. And I probably have a particular perspective on this because of the role I have and where I sit in the system, as it were. But yeah, I mean, more consistent data standards would certainly help in terms of our ability to share data and some of those things. And there's the range of things going on there that we can do to do that better. I also think there's probably some cultural things at times as well. I think we potentially have when we're not at our best, slip into slightly more competitive rather than collaborative ways of working. And I think certainly for those people that are reliant on pots of money to pursue what they need to do, there can be a little bit of a kind of zero-sum game approach to this. There's a finite pot of money, and if I don't get it, someone else will, and therefore we start to become competitive with one another. I think we need to probably try and work together to make that bigger argument, to get the bigger resource base, so we all get, all ships are raised by a rising tide, or whatever the cliche is. So that's one thing I think we might want to think about. I also wonder whether sometimes we're again, speaking from where I sit within the system, whether we can be guilty at times of being a little bit too target driven, and that again can create a kind of a slightly competitive nature, and also it can create a barrier between funder and intervention at times, which becomes perhaps less, again, the word Larissa used, transparent at times. We need to accept that not everything we fund is going to work exactly as we planned. It would be very odd if it did, and we wouldn't be taking any risks probably if we did that. So we need to be open to the fact that there's some things perhaps won't work exactly as we hoped, through good process evaluation and then good evaluation of impact. We will learn from those things, and we'll take the good things we learn and replicate and scale those up, and we'll hopefully learn not to do the things that weren't so effective in the future. And I think those are really important cultural things we need to all be comfortable with one another about, if we want to get to a better place around kind of sharing, collaboration, and those sorts of things.
Yeah, and I think trying to involve as many people from the start, as I think Lauren's mentioned, so publicizing what you're planning on doing and seeking advice from others, opening your methodology up for critique and feedback from others to improve the way you're going to do things, essentially, and also where, again, I guess this is a question of resources, but where resources permit, involving people along the way. So testing findings along the way, testing approaches and adapting them if it turns out they're not appropriate or they're not working.
Yeah, I think we need to incentivize the process in some ways, really. So you know, it'd be great to see a prize awarded for the best data set that had been contributed by an organization, for example, you know, where it had really strong methods and so on. But equally, like, if we can have a data sharing platform that when you put something in, because let's face it, data collection takes time and effort and energy, it's difficult to do, that it'd be good if we could have some kind of platform that created a dashboard where people got something back. Andrew will probably tell me that Sporting would already have something like that, I don't know. But you know, something they could use to inform their learning, and something that can kind of spit the data in a visual way that'd be useful for them would be kind of a nice tool to use too.
I'm afraid, Lawrence, we don't quite have that yet. I think it's an aspiration that's shared by others. I mean, I think, you know, there are some really useful data collection tools out there. There isn't one thing where I guess, you know, we all, you know, absolutely can collaborate and do things in an absolutely consistent fashion. But yeah, I think the aspiration makes perfect sense, and one certainly I'd endorse. Yeah.
Yeah, I think so. You know, we talked a little bit there around the planning and opening up the methodology for critique and sharing. And Andrew, you touched upon the point of the competitiveness of some of this work. So it sort of makes me think around the sort of once we've collected that data and the sharing of the actual results. You know, how having a platform would be absolutely fantastic, but if we're working with maybe where there's commercial sensitivities around data, how can we ensure that those kinds of data sources and evidence are shared in a way that balances the need for sharing universal learning versus the sensitivity that kind of data has? Has anyone got any experience that might be able to help with that element?
I'd start off just by saying I think it is really challenging when we use commercially sensitive data, and in some ways that's the very nature of the type of the research that I do. I think it's really difficult, but I think to come back at that, what we've seen is probably a trend towards research being summarized in nice infographics and, you know, visually attractive presentations, but actually without, again, to use the word transparency, without the method, without the ability to scrutinize behind that research, it's actually not particularly useful or usable, certainly in my field, when it then comes to feeding into models. So it's, you know, we find ourselves in a situation, whilst appreciating the sensitivities of data, if we don't have that transparency, then we can't enhance the way that we can evaluate and measure and monetize, from my perspective anyway.
I mean, I think there are a range of other issues related to data protection and various other things that we also need to be mindful of, Matt, which can make this even more challenging. But the thing I'm generally encouraged by, though, I think when we have these sorts of conversations with partners, are sometimes ones you think would be very protective and you know and quite jealously guarding that some of the data sets. There's actually quite often certainly an appetite to do more of this. But as Larissa, I think, sort of alluded to, sometimes it's quite difficult to find the route through to be able to share that data in perhaps the ways people would want to, and we do have to respect the kind of intellectual property or the value of some of those data sets to some partners, and therefore, you know, that in some instances there would be a reluctance to share them. But yeah, it's sometimes it's surprising how open people are, at least to explore those things and try and find solutions, even if some of those solutions are quite challenging and difficult.
Is there anything on the sort of the more academic side, Lawrence, around sort of the open data sharing that you can add to this? I think it's great what Andrew's saying around, you know, if you ask people, they're probably more than willing to share their data. Maybe just need a couple sort of trailblazers in showing our data sets are open for X use, as long as they're around sort of the right data requirements and data protection rules. But I wonder in that more academic world if there's anything slightly any learnings that we can take from there.
Well, I think it's important to recognise that publication bias definitely goes on in academia too. So we tend to see that those intervention studies that aren't effective don't always get published. We don't always hear about them. So that's not just a practice-based issue, it's definitely an academic issue too. I think the thing about academics and data is generally they want to be acknowledged for that data. So I think they are quite willing, from my experience, to contribute data to a pooled data set, for example, but they want their name on the publication is probably a condition of that really. So that culture might change over time, but at the moment, it seems to be that people want some acknowledgement from my context and understanding anyway, for doing that really. But I think things that are helping are things like more transparency around, pre-registration information, around protocol papers, about the methodology being published in advance. And then that means we can kind of know whether the evaluation was done as originally planned and hasn't been kind of manipulated to favour an intervention effect, for example. And that kind of transparency is important for our understanding of the literature, but also for things like replication. Okay, well, if we did this study again, would we find the same results? And that's also an important issue right now in academia.
Absolutely, yeah. And the sort of open science world and the policies that go along with it, sort of pre-registration, preprints of articles, is something that we're trying to instill into our work at ukactive. Dr. James Steele, our principal investigator, is sort of leading that, and it is trying to change it. It doesn't work in every setting, but it's really important for us that we can sort of, as Jess said, open up our methodologies for critique, share the data where possible. It's going to have further learnings, and I'm sure it would benefit the majority of people on this call. So just to move on a little bit, we talked around some of the data collection and the data to sharing and uses, but I want to sort of move on a little bit to the businesses, the charities, the people across our sector. How can these companies and things really sort of understand the true potential and value of the data that they hold, if they don't already understand it? Open to whoever wants to go first on that one. I won't pick on you.
I think Lawrence talked about a prize for the best data sets. I think one of his earlier answers. I think there probably is something around showcasing and celebrating people that are exploiting, or if that's the right wording, but using and utilising the full value of their data to increase the impact and effectiveness of their organisations. I think that then becomes a kind of a beacon or an inspiration to others to do more of that. So I think that's part of it. Yeah. I think there's perhaps some sort of guidance and support that we can offer to people in that space as well. So yeah, probably not particularly novel or new thoughts there, Matt, but just some things I think that potentially we could do more of.
I think there may also be a role in just thinking more broadly on a population level. A lot of the data that is collected by national government agencies still doesn't always have large enough samples to draw conclusions about smaller groups, whether this is by age, or in our case, we're interested in age and other characteristics. So we're often not able to draw conclusions about people in their 50s and 60s and another characteristic like a certain ethnic minority. And I think that's where it is, again, really important to make sure that groups that are often not represented in the data otherwise are represented, so that they're systematically oversampled and ensured that we can draw conclusions about groups that yeah, we've been missing out on and haven't really been able to see if there's a different story to tell there. And I think that's where I mean, the part about businesses, I don't really know what the answer is to that. It's not something that we've done successfully to date yet. So if anyone does have any tips on how to successfully work with businesses to ensure they understand the potential of the data they hold and how they can better share it, then I don't have an answer to that one right now.
No problem. So Lawrence or Larissa, do you want to come in on that question? Anything to add?
Well, I was just thinking in my head. I mean, ukactive done like hackathon events before. Maybe we need to get these organisations together in a room and discuss the potential opportunities that they might have in their data sets to go through. That could be one way forward.
And I think, again, I don't have anything kind of groundbreaking to add other than to say the showcasing of research, for example, giving us the opportunity to talk to the sector about the research that we've done with Sport England, showcasing it in different forums with different stakeholders across the sector probably helps those organisations appreciate the value of doing that and spreading the message, and you know, then hopefully the wider audiences can appreciate the value and perhaps think about how the data in their organisation could then be used, or how it could possibly feed into bigger you know, research projects, evaluations, and so on. So I think dissemination of research, dissemination of data sometimes is probably undervalued, and I think that probably has quite an important role in, I guess, encouraging businesses, charities, other bodies to do the same.
Absolutely. I think that's, you know, some really good points there, and you know, it'd be great, Lawrence, to have that kind of hackathon idea, and you know, maybe you can get a, as we've been talking about, collaboration, open sharing platform where we can look at data if people need support on it, and we can really sort of help connect the dots and put people in the right contact with, depending on expertise and things. That would be fantastic. So thinking again a little bit sort of broader, and within your sort of different areas of expertise and things, what are the most pressing sort of government policies or interventions within your fields based on the data you've collected or the data that some of your colleagues have collected? Again, anyone can jump in to kick this off.
I'm happy to start. So I would say, I mean, most of the stuff that we've been focusing on most recently is the impact on COVID on our age cohort, so people in their 50s and 60s. And I mean, the pandemic has really exposed the really long-standing health and economic inequalities that that across the population, but in particular for our age cohort. And it's also really highlighted how undervalued physical activity is as an intervention. So the Center for Aging Better, along with the Physiological Society, actually earlier this week came out with a report where we specifically recommend physical activity as one of the single most impactful ways in which older people can reduce the risk of developing severe COVID-19, improve their recovery, limit deconditioning, because that's something that we're seeing on a large scale, is a lot of people spending a lot more time at home, being sedentary, not moving, losing muscle mass, losing aerobic fitness, losing bones density. Physical activity is a really important factor in that, and we're recommending things like clear guidance about encouraging exercise and physical activity during, you know, these lockdown months and winter months, and supporting nutrition, mental health and well-being, and also looking at supporting behavior change.
Yeah, I think to add to that, really, I guess, you know, if you're ever in any doubt about the power of policy to inform behaviour change, COVID's kind of given us fundamental knowledge around that, really, about how our behaviour has been influenced by government policy, you know, throughout lockdown, throughout the summer, really. It's such a powerful drive for behaviour change. And I think for me, so yesterday, you know, I'm not sure they're COVID related, but yesterday the International Society for Physical Activity and Health launched their 8 investments that work for physical activity. So I would always kind of advocate for those kind of investments in kind of the whole system, really. So active travel, whole school approaches, workplace interventions, healthcare interventions, the whole spectrum really is where I would go. I guess COVID has really shone a light on active transport, walking and cycling, and the efforts made around pop-up cycle lanes, for example. All those kind of initiatives have been really interesting. I guess in my population specifically, children and people, I think there is a lot of school-based programs. I think there probably needs to be more funding for outside of school programs. I know Sport England will do some of that as well, but from the government as well, probably more recognition of the importance of outside of school and community programs. And I think that it's really important, and obviously, you know, ukactive, Sport England and others are really important in this, in that ensuring that the sector survives COVID, and actually, there are opportunities for children and young people to be active post-COVID. And then my final kind of policy is really around what I think are a bit of a forgotten age group, and that's the under fives. So I think we need much more work for physical activity promotion in under fives. It doesn't really go on enough in early years settings. I think that's an important area for the future development.
Yeah, I'd probably endorse that, Lawrence. And actually, the reason that we didn't include younger children in our study is because of the lack of evidence for that age group, not that impact doesn't exist. So I think that's really important. And I think my message, probably, Matt, would be going back to a point I made in the earlier part of the session, which is that, our research demonstrates that sport and physical activity can generate multiple or impact across multiple outcomes, and can have a wide-ranging impact on society. And I think providing opportunities and investment to engage people through participation, volunteering in the sector in sport and physical activity is really important for the economy, for a happy, healthy economy, for well-being. And I think that the situation we find ourselves in now probably highlights even more the value of sport and physical activity. So I think having the research and the evidence to make that case to government probably makes our argument stronger.
Yeah, I mean, I think the other panelists have, I think you asked for the most pressing things, Matt, and we've already come up with quite an expansive list, which I could add to further. I think social prescription is a really important thing. Childhood obesity strategy, which I think was sort of, fits within that sort of children, young people area. I think there was some reference to, system change and place-based working. And I think that's a key thing. And obviously something I think Sport England put quite a lot of effort into in recent years around sort of campaigning and social marketing being a really, so there's a whole raft of things we can do. And I think probably just building what Larissa said at the end there, it comes back to, for me, fundamentally, a lot of people are physically active, but we'd like even more to be physically active so they can enjoy those benefits. And certainly when we scratch beneath the surface, as Jess has spoken to quite a bit, and others, there are some really stark inequalities in the levels of engagement we see, and we absolutely need to get stuck into those as well. So it's how we deliver these benefits effectively across all of those agendas to as many people as possible in the most equitable ways.
Absolutely, there's lots of fantastic points and lots of pressing sort of policies and interventions. And one thing that I think is really important to bring up as well, that maybe doesn't fit into your areas of expertise, but I'd be really interested in your comment, is the current situation is changing all of our working environments. I don't think any of us are in our offices, or certainly shouldn't be, probably because of the lockdowns and things, and we're all working remotely from home, and that's changing sort of our habits that we're so sort of set in our ways within the workplace, whether that's going to the gym at lunch, which might not be accessible from home, and all those kinds of things. Are there any sort of, how can we use the data and evidence, and are there any pressing things that we need to sort of instill to government around the importance of physical activity during the working day? I think, Lawrence, you're probably the only one standing up. Is something standing up that should be important? That's something I'm starting to feel like I need to go for a walk or something. Is that something that we should be encouraging government to further support, because we're changing our working environment at the moment?
I think some messaging around sedentary behaviour in the workplace, being the home workplace, wouldn't be a bad thing right now. Yeah, and breaking up your sedentary time every 30 minutes or so, those kind of things would be useful messages. Yeah, I agree.
Yeah, again, not a body of literature I'm that familiar with, Matt, but I think, I think, it's right, and you're right to say fundamentally for many of us over the last 6-7 months now, our working pattern has changed dramatically. I used to get 10,000 steps a day in, from my various home to station to office and back in the other direction in the evening. I would routinely rack up a range of activity, moving from meeting room to meeting room, or speaking to colleagues. I now routinely sit in front of my computer for 7 or 8 hours a day, and it's not good for me. It's something I need to learn how to carve out the time and make new habits to find ways of becoming more active during the working day.
So just because we're not in a workplace or a traditional workplace doesn't mean that workplace well-being in terms of physical activity and the wider benefits that has is no less important. If anything, it's probably more important because we don't have that daily or hourly encouragement to walk from room to room.
Yeah, I think for me, actually, I guess most of us in this room are in service-based jobs and employment, really. That there will be others that probably, are still quite active in their daily jobs, in different kinds of jobs. And I think for those people, actually, it's about, okay, we're now in winter, just as you were going out for a walk in the summer for your mental health and well-being, still find time to go out for a walk or find an activity that you could do, outside of work for your mental health and well-being. It's going to be really important to try and get through the winter.
Absolutely. So I'll open it up to the Q&A in a second. I've just got one final message, which I think we touched upon a little bit just in the answer previous to that workplace question, is around, so anything you'd like to add around sort of your key messages to government around the importance of sort of data evidence for the use of healthy physical activity wellbeing interventions? Is there anything you'd like to add following the earlier questions and answers?
Sorry, was that specific to the workplace or more generally?
Just more generally to your area of expertise or to the workplace.
I mean, I guess the other thing that we would want to add, maybe not specific to the government, but really a challenge to the sector, is to think about what else can be done to make your services and offers more age inclusive. So we know that older adults tend to not engage with the sector as much as younger adults, and it'd be interesting to explore why that is. And the Center for Aging Better is actually actively working with ukactive to look at this issue in more depth. And yeah, I'd really encourage everyone to think about what more can be done to tailor services, to think about what the barriers are, and to make all services more age inclusive.
I think my only additional message at this point would be around, and I think Larissa alluded to this earlier when she made a comment about something along the lines of sport and physical activity interventions can deliver, a range and a broad range of different social values simultaneously, is how sport and physical activity can deliver across a range of policy areas, and that we need to be able to recognise and kind of reward that, as it were, in the ways we sort of design and support and fund things. So it's that being able to cut across, what might be called departmental boundaries, be that a national government or a local government level, in a way that isn't too territorial. There are, probably perhaps public health leads or people working on it, sort of youth development and various other things, who could quite sensibly and legitimately, contribute to interventions and funding in different parts of their, their organisation that deliver sport and physical activity, which will pay back to them, a considerable dividend down the line if they have the sort of freedom and foresight to do that. And I'd encourage more people to do that.
Brilliant. So thank you very much for that. We've had quite a few questions come in from the guys watching, so I'm just going to sort of work my way through them and direct those questions to you guys, if that's okay. So the first one is a question for you, Lawrence. So ISFA, so the International Society for Physical Activity and Health, have recently updated their investments that work for physical activity report, identifying the whole of school programs as a measurement driver. Could you just expand on what is meant by whole of school and what does this look like in practice? Okay, so as a caveat to this, I've not read the detailed document yet from ISPA, but I'm going to go with what I know about whole of school approaches first. I think it might be similar. I think the first thing is about the culture of the school itself. So does, from right from the head teacher, top-down approach, does it encourage a culture of physical activity? Does it champion activity in the school? Does it value it? And then it's about really having multiple opportunities in the school for activity. So that could be
things like before school breakfast clubs, it could be things like break times, it could be lunch times, alongside those traditional things like PE, having a good quality PE program. And then in addition to that, there's also other opportunities, for example, integrating more movement into classrooms. So actually, doing more active learning kind of techniques, getting kids to move around within a classroom setting, but also maybe using more novel teaching methods, for example, teaching maths through physical activity, using jumps to the counting numbers or whatever, right? That alongside activity breaks, so actually having a bit of a time out of the classroom and doing things like the Daily Mile or the Kids Marathon, those kind of events, really, where it's a time out and a window in the day for activity. That, along with giving people choice, so children and people should have choice. They should be able to choose activities that they want to do that are relevant for them, and there should be opportunities for all abilities. So you're not prioritising those kids who do the best at activity and sport, but actually you've got an opportunity for low skilled kids, less confident kids, to do something that they enjoy and will take part in. That's off the top of my head, so hopefully that's a good interpretation of the whole school approach.
It sounds great to me, and that one was from Jack Shakespeare, just to put you on the spot. So you can blame Jack for that one. Going back to what we talked about earlier around standardized uniform measures, a question's come in asking, are you aware of any data sets or resources that cross from the health side of our work through to population, so that encompasses everything? Is there anything that's available around those aspects? I'm not sure who wants to answer that one.
I'm not sure I entirely necessarily understood the question, so apologies to the person who asked it if I make a mess of this. But I mean, I think there are some data sets which do occupy that space, as it were. So obviously the Health Survey for England is something that speaks to a whole range of, what we might consider sort of preventative risk factor, public health kind of measures. And I think that's probably the most obvious one. Obviously that has run physical activity modules within it periodically over its life, but obviously speaks to other health factors like smoking, drinking, diet, alcohol, various other things, and actually speaks to physical activity in a very broad sense, occupational, domestic, as well as active travel, sport and physical activity, exercise, etc. I'd give a little plug for Active Lives to some extent as well there. You probably wouldn't be that surprised by that. I mean, as well as that broad definition of sport and physical activity we talked about some time ago, we've certainly worked or continue to work with the Department for Transport, supporting some of their local walking and cycling statistics, which very much plug into the active travel agenda. But we also work with Public Health England, not just to support the physical activity measures that they include on their fingertips tool, but also the height and weight data, which gives us an idea of excess weight in a population, and also some of the fruit and veg consumption data as well, which again, got some useful data sets there that I think do enable us to understand perhaps the individual's lifestyle, not just their physical activity behaviour.
Fantastic. Hopefully that answers that person's question. Andrew, another one probably for both of us here, seeing as we're referencing it. One's from, how can individual researchers get support from organisations like ukactive and Sport England to get support for creating more impact from their work? So I'm happy to answer a bit of that, but if you please jump in. I guess it's elements that we've discussed already. It's that collaboration approach. I don't know your field of expertise, but and the work you're undertaking, but we've discussed the collaboration approach, not in competition. We're all here to show the value of physical activity and the wider benefits. And I guess from my side of things, it's just get in contact with us, and we'll do our best to help. If we're not the right people to help, maybe a different field, or we might know someone who can provide the support. For example, if it's children and young people might be putting you in contact with Lawrence, or aging putting you in contact with Jess, and making those connections. That's what it's all about. We're a network of researchers, project deliverers, intervention deliverers, activity providers. We're all in this together. So you may work on your own, but you're not on your own, is what I would say. I don't know, Andrew, if you've got anything from a Sport England side.
No, I think that's great, and I'd echo those sentiments. I mean, I think there are a range of things I guess I'd freely admit it's an area I'd like to do more of and do better. We have a tendency, I think, a little bit more often than we should, to be quite transactional in the way we deal with researchers at times. We're used to sort of commissioning work, and I don't think that's always the best way of getting the most out of those relationships. So more partnership kind of approaches be something I'd welcome. I mean, in terms of things we can offer, say alongside this kind of networks and advice and guidance sort of stuff that you talked a bit about there, Matt. There's obviously where people are certainly in an academic sense, bidding for perhaps research council funding or various other things, where they've got a project they think aligns with the sort of goals we have as an organisation. We're very happy to have that discussion, and where appropriate, offer some sort of endorsement or support for some of those ideas going forward. I think the other thing I would talk about is some of the kind of resources that we have available that people could use. I mean, we put routinely data sets on the data archive and things like that. So those are there for people to use and exploit. And if they're not, SPSS or R-Whizzes, and can do all the statistical analysis themselves. We've even got sort of tools like our online tool and various other things where people can go in and do their own kind of secondary analysis and dive a little bit deeper into some of our data sets, which I think is always at the very least a useful way of putting context around any research you might be interested in. Because I think, as others have said, we tend to start with, not enough people are physically active, or we have a particular concern about an audience, that is not as physically active as we'd like them to be. And some of the data we have and the data we gather can speak to some of that, so it can be helpful. So there's a range of things I think we can do.
Absolutely, and there's a couple more sort of statements and questions. One from an academic that we work with at ukactive, saying that where we're talking about data sharing and the openness of data in some other fields such as physics, there's hundreds of authors. We don't need to limit it to just a small group. Be collaborative, open up your group. That the more of us, the better. And then another question around using young early career researchers, those that have worked on their dissertation or might be at master's and PhD level. We've probably all got so much data that we quite often don't know what to do with, and having that wider group around us can really help to answer some of those questions that unfortunately we might not actually get time to. So yeah, always happy to explore those kind of areas. Jess, I've got a question for you. So this person's really interested in what you mentioned around the importance of activity to prevent or to support with COVID and the rehabilitation. And just, do you have any links to the research and the facts and the figures that you mentioned? Where's the best place to go to find that info?
Yep, I'll just I'm going to paste a link to the report that came out earlier this week. And then, so that's just the Physiological Society and the Aging Better report. The Society for Physiotherapy has done quite a lot of work on physical activity and rehab. So it's worth going to their website and looking at specifically at the stuff that they're doing for rehab. They also host the Community Rehab Alliance, so have done a lot of work on this issue.
Fantastic. Hopefully that'll be useful for that person, and please do get in contact if not, and we can pass those links on. The next question is around social prescribing, and do we have any examples of how and where social prescribing is working well at the moment? I can't remember, was it Andrew, Jess, maybe one of you mentioned it earlier. Have you got any examples of where social prescribing might be working well, or is it something that we need to get further data on?
I mentioned it. I must confess I'm not, certainly by any stretch of the imagination, the most authoritative person on this area in my organisation. unfortunately, there are colleagues in the health team at Sport England who are absolutely immersed in this, and I think could wax lyrical and offer some fantastic examples of this. I mean, it's an incredibly important area, and it's one where we are seeking to build, stronger and better alliances and really support it. And I think we see it as a key theme going forward. So I probably would stop short of trying to sort of bluff my way through on providing some practical examples, but I think the point is an excellent question. I think, I'd happily follow up with that individual and perhaps join them up with colleagues in my organisation who I think could speak with more authority on that. I don't know whether, Jess, you've got anything you can speak to in that area.
I don't have anything specific, but I think it is important to make this link that they are the link between, or can be the link between, the physical activity sector and the and healthcare professionals. So it might be worth, even in your area, reaching out to healthcare professionals and seeing what's happening with social prescribing, and seeing if your services could be something that is prescribed into.
And I would also add that I also have colleagues in the Advanced Wellbeing Research Centre at Sheffield Hallam that I know have done work around social prescribing and done SROI studies of that. So again, I could connect relevant colleagues up with the person that's inquired about that.
Absolutely, and obviously yesterday we announced our strategic partnership with the AWRC at Sheffield Hallam, so we're linked up there, and we can definitely make those connections. And I'd encourage you as well, everyone watching, to attend week 4 of the National Summit, where social prescribing will be discussed in a lot more detail. So we might be able to get some answers from that week as well. So another question that has come in on using data and how the government react to it. The blunt question is, do they understand it? Do they get it? Do they get the value of physical activity in your opinion? Anyone, go on.
I think they do. Yes, I think we have an onus as people that provide data and interpret it on behalf of people that aren't, perhaps career researchers or experts in that, to do it in a compelling and useful and accessible way for them. But no, I mean, I think during the time I've worked in for Sport England and the sport and physical activity sector, I think we've come leaps and bounds. And I think actually, if you just probably looked at how government and Sport England strategies have kind of evolved over a period of time, I think they've become increasingly more, aware and conscious of an evidence base that should be guiding and sort of supporting decision making. So, yeah, I mean, we'd all like, an even better settlement for sport and physical activity, and more money to flow into our sector. But I think there is a recognition of the value of sport and physical activity, and we need to continue to grow and build that and broaden that as well. So I think it's probably possibly most well understood in public health and sort of physical activity, physical health benefits, where we need to perhaps work a little bit harder to build them as some of those other areas. But yeah, I think it's there. I think it's recognised, but we need to continue to keep making that argument, keep advocating, keep making the case.
I mean, Boris Johnson did mention it after his bout with COVID, saying that we should all be cycling more. So I guess there is some level of recognition at the highest levels.
Yeah, I think there is a recognition of the role that sport and physical activity have to play. I think work like ours helps to advocate that. And I think whilst methods that we've used within our research are traditionally or intended to be used to help organisations improve the social value that they deliver, actually what they also do is enable organisations to prove what they deliver. And I think that's really important for the messaging. And I think putting research in monetary terms helps translate that message beyond the sector, whether we agree philosophically or operationally about monetizing value in our sector. It's a common currency, a common language that speaks to other sectors, that speaks to government. So I think that does have a role. And I think the advocacy argument is not just something perhaps for UK government. So I work in this area and in this space internationally, and a lot of the work that we do is commissioned for advocacy purposes. So I think it is really important to be able to evidence to get those messages across to government, and hopefully they do listen and understand.
Yeah, I think just to add to that finally, we've got really good evidence now of the social and economic value of physical activity. I think what probably the COVID pandemic situation has probably led to is maybe that the public might value physical activity as a sector more than they might have done previously. So what that might actually turn into is maybe more public support or public pressure on government policy and government funding to fund the sector better, really. So that might be better for us in the long term, even if there is some quite substantial short-term pain going on now.
Yeah, brilliant. I totally agree with all of your comments. That's actually all the questions that we've had through, and hopefully we've covered everything that everyone wanted to know. So thank you for everyone watching, for your engagement today. We hope that you found this session really useful, and you're able to take a lot away from it. The recording will be available on our YouTube channel in the next few days, and keep an eye on our Twitter and things, and we'll make sure that link is shared for those of you that want to go back. Thank you to Larissa, Andrew, Jess and Lawrence for your time today, and preparation for the talks and things, and your valuable insights. I've personally really enjoyed our discussions, and have taken a lot away. So thank you very much. So next week we'll have the third of our four National Summit sessions. Next week we'll be looking at placemaking for better social, economic and public health outcomes. So go to the ukactive website on the National Summit page where you signed up for this one, and make sure you sign up. And again, the final week we'll be looking at integrated approaches to health and social care, where we'll discuss a bit more about social prescribing, as I mentioned. So yeah, finally, just thank you very much all for your time, and hope it was useful. Thank you.